I'm in a very happy space. मुझे तो जरूरत ही नहीं क्लिनिक के चार्जेस कैलकुलेट करने की. I send my assistant to the neighboring clinics. He inquires about the prices and I keep my prices lower than that. मेरे पड़ोसी के जो चार्जेस हैं मैं वही अपने क्लिनिक में रख लेता हूं. आई एम इन अ वेरी हैप्पी स्पेस. आर यू ऑल्सो थिंकिंग लाइक दिस? इफ यस, दिस वीडियो इज फॉर यू. Hi, I am Dr. Bhavdeep Ahuja. I'm a dentist with 23 plus years of experience, and along with dentistry, I'm training and coaching colleagues on the topics of practice management, medical legal ethics, consent documentation, and finances in dentistry. So in a recent survey that we did in our WhatsApp community that we are running since 5.5 years, I had put up a pain point survey in 2022 and of course in 23 as well. So I had taken up a few queries in the pain point sessions, but yes, a few were still left. So I'm picking up one of those queries which I came across and I am, you can say, trying to answer those things. So this was a query from a dentist from Dubai. So can we base our prices on what the other dentists are charging? If yes, how can we know what they are charging? It's not possible to find about all clinics by calling and they don't give clear answers. The first thing is that if you are deciding to charge based on your neighboring dentist, I'm sorry to say you are one of the biggest fools. Pardon me for saying that, but this is a very, very stupid philosophy to follow. Your cost, your charges are pretty much unique. Your procedures, your costing decides your charges, how much profit you want to earn, rather than your neighbor. Your neighbor may have a totally different set of expenses, and you want to be in a total happy space where you want to call up all your neighbors, all your neighboring dentists, and expect them to tell you prices so that you can keep your prices accordingly. Very, very pathetic thought process, I must say. You need to firstly work on your costing, calculate your costing per procedure and charge as per. Because if your procedures are more costly input wise and your neighbors are less costly and whatever the charge, if you keep the same charge like them, then ultimately your costing will make sure that you carry home less. And the end result would be you'll be cribbing and cursing dentistry. So I know you are in my WhatsApp community since pretty long. So watch my costing videos. They'll be a great eye-opener for you. Go to YouTube, go to my channel, search in profitability in dentistry. You'll get all condensed into one video as well. You will get 5 parts of video. I'll recommend watch all the 5 parts in sequence. So you'll get to know what exactly a procedure costs, and that should decide your charges. And I'm sorry, not your neighbors. If you're thinking on those philosophies, you are actually doing an injustice to your clinic, because that will make sure that you may be putting in a lot of effort, good materials, good skill set, but your charging is pathetic because you don't want to charge above your neighbors. Now, the second query in the same was, sometimes the patients don't ask for price before doing the treatment. I'm also hesitant to discuss the price beforehand, especially with long-time patients. Is it okay to tell the price to such patients after completing the treatment? No, 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 no to all these 3. You have to tell the pricing beforehand, or else you will face bargaining issues. You will face, you can say, trust issues in the end that you didn't tell. It is all. And we go a step further. We always want the patient to be on the same page. So we need to have the patient on the, you can say, same page and sign the documentation also, sign the consent also, sign the treatment approval form also, sign the payment protocol also, so that we know he or she knows whatever we are going to charge. So discuss, not discuss, properly detail the patient about the charges they are going to incur. Get it in written, get it in black and blue, get the paper signed that whatever charges you have decided mutually. So don't go into that part. So is it okay to tell the price? Yes, hell yes. You have to tell it before, Or else you will face a problem that, doctor, you are looting us. You never told us charges beforehand and your bill is 20,000. I'm sorry, I can't pay it. Then what will you do? What evidence or what you can say what barter you have in your hand, or what mortgage you have in hand that you will recover that money from there. So if you're not doing that, you are doing a big mistake. Now, the third thing is what script to use for patients to come back after 6 months for monthly checkups. Also, if a patient has undone treatment, how often we can remind them to come back for the treatment and what script to use it so it does not sound that we are being pushy. The thing is, always take a proper feedback. Always take a proper, can say, a customer experience in your clinic. And of course, when you try to sell something, you have to sell via script. Don't sell by default. We don't even prepare for those scripts. We don't even prepare for those scripting of, you can say, sales. Sales happens automatically in our clinic. And of course, when the conversions don't happen, we blame the patient only. That the patient went away because he or she did not like our price. Now, you already said that you are not divulging price. So in your case, even if the patient is not converting, those things are to be taken into account. It is a process. Clinic running is not a juggling of, you can say, balls between your hands that you can do a practice and do it. You can say randomly do it. You need to practice for it very, very hard. And one script will not fit all your patients. It is a matter of different experiences, different scripts that come in handy. And you need to have a conversation loop, develop your communication skills, whereby you can encourage the patients to, you can say, have a total, you can say, where you can do your objection handing of the patients, that if it is because of price, if it is because of time, if it is because of the procedure involved, what is that is holding them. So spend some time on consultation and always try to find out the reason why you did not get consultation. So don't rely on age-old formulas. Times are changing. Even in those age-old formulas, you could not work by this method. So if the procedures are not converting, even if you're not telling the pricing, or even if you are telling or not telling aside, then probably your communication skills are not up to the mark. Sorry for being so open and so crude, but yes, somebody has to say that. If you don't even realize that your questions are actually in the wrong place. I'm not saying your questions are wrong, but your questions are placed in the wrong, in a wrong way to you, where your thought process has directed your mind towards, you can say, in that direction, where you believe that there is some magical formula, there is some magical script that will actually help you in learning the art of management, learning the art of practice management overnight. I'm sorry, that is not the case. If you're thinking that ways, you are actually befooling yourself. So get yourself learned, get yourself trained, learn these things. Whatever you don't know marketing, learn about it. You don't know selling, learn about it. Make those things which you don't know as your learning goal. And I hope I have answered your queries. So if it did resonate with you, please do reply. And of course, all of you, those who are watching, if you like this video, please you can say, share with your friends and colleagues, and do subscribe to my channel. And I see you in another video of mine very, very shortly. This was a tribute on Guru Purnima for all my group members. And if you want to join my FB community or my WhatsApp community, please do message me. I'll add you over there. Bye-bye. Take care. Till we meet again.